Over the last 24 hours, we have identified 1,270 new cases of COVID-19 and completed more than 17,500 tests. This means our positivity rate currently stands at about 7.3%. There are 749 people in hospital, including 139 in the ICU. AHS continues to take steps to increase capacity and expand the number of acute care and ICU beds that are available. Some of these are new beds, and in some cases, existing hospital spaces will be made available as patients are moved into continuing care beds in the community. AHS is also working with the Canadian Red Cross to set up an alternate care centre at the Butterdome on the University of Alberta's campus. As you may recall, AHS used the Butterdome as an assessment centre earlier this spring, and a temporary structure has also been in place for months at the Peter Lougheed Centre. It will take a few weeks to set up the care centre, which could add an additional 100 inpatient beds. There is no plan to staff these beds unless they are needed. This is a purely precautionary measure for use if needed in the future. Sadly, I must announce that 16 new deaths were reported to Alberta Health in the last 24 hours. My thoughts are with those who are grieving the loss of these individuals. Every death is a reminder that we must reduce the spread as quickly as possible. It is a sobering statistic that in less than 10 months, more Albertans have now died from COVID-19 than have died from influenza in the last 10 years combined. Looking to schools, there are currently active alerts or outbreaks in 452 schools, or about 19% of schools in the province. Currently, these schools have a combined total of 1,964 cases. Speaking of young Albertans, as you know, last week we announced a new advertising campaign that is targeted primarily at those under the age of 40. In no way are young people the sole cause of the rise in cases that we are seeing. However, this virus affects all of us, no matter our age. Today, I want to remind anyone who is in the 20 to 40 age range that this virus also impacts you. In Alberta to date, more than 32,000 people between the ages of 20 and 39 have contracted COVID-19. More than 380 of them have been hospitalized, and sadly, 8 of these have died. To put this in perspective, if you gathered every Albertan between the ages of 20 and 39 who has been diagnosed with COVID-19, they would fill the Saddledome in Calgary, the Centrium in Red Deer, and the NMAX Centre in Lethbridge. This virus does not discriminate, and it can have long-term and potentially devastating impacts on all of our health. No one of any age can take COVID-19 lightly. Yesterday afternoon, the first doses of the Pfizer vaccine were administered in Alberta. It's incredible to think that within a year of the virus being discovered, we already have a vaccine that is 95% effective, and that it is already going into the arms of those caring for our long-term care residents and the sickest patients in our hospitals. We will continue to immunize healthcare workers in Calgary and Edmonton this week. When another 25,000 doses arrive next week, immunizations will expand to priority healthcare workers province-wide. I know that any time there is a new vaccine, it can cause anxiety and questions. It's important to remember that Canada has one of the most robust regulatory systems for new vaccines in the world. Health Canada moved quickly through the approvals processes, but no steps were skipped. The same rigorous testing and scrutiny was applied to this vaccine as to any new treatment. The ingredients inside it are only those needed to keep the vaccine stable and safe. And a clinical trial with tens of thousands of participants from multiple countries found no safety concerns. Health Canada is being cautious and making sure there is clear evidence of effectiveness and safety before offering vaccines to Canadians. For example, that is why it has not yet authorized the Pfizer vaccine for those under 16, as there are no trials complete in this age group yet. Because this is a new vaccine, we will also be watching closely to ensure that if any safety signals emerge, we will be able to detect them immediately. Alberta will be working with all the other provinces and territories and the Public Health Agency of Canada to closely monitor for adverse events. I believe the benefits of vaccines far outweigh the risks, and this vaccine will save lives. There is overwhelming scientific evidence that vaccination is the best defense against serious infections. We are taking every precaution and acting on clear evidence showing this vaccine is safe for Albertans and it works.